Hello and happy day to you. I'm Instructor Pamela and welcome to HIT 2200 Week 2. This week we're going to continue to focus on learning and how to identify our ICD-10 guidelines in the ICD-10 book. Again, it's very imperative as a coder to understand how to interpret the guidelines. These are our golden rules of how a coder should, again, follow the coding instructions to ensure that we're always coding to the highest specificity and obviously correctly according to the provider documentation. We're also going to dive into the coding conventions, which is basically like our instructions of how to code basically every scenario within the ICD-10 book. For example, you'll see a red bullet or you'll see a triangle. There are different symbols that identify what a coder needs to do. For example, if you see a red bullet, that is telling you that you are going to have additional digits in your main code. So for example, if you have I10, you're going to see a red bullet on the side of the I, and it's going to indicate that you need an additional digit after the decimal. So it'll be I10.12, for example. So again, our conventions are very imperative. They provide instructions of how a coder should code each scenario within the ICD-10 codebook. We're also going to continue to develop our skills in selecting our primary diagnosis as long as the secondary diagnoses. Again, all coders will always be assigning the diagnosis, which is basically the problem. For example, I have a fracture of a tibia fibula. That's your diagnosis. I have back pain. I'm having a migraine. I have pericarditis. These are all diagnoses. This is the reason why patients are receiving the services. So again, we are going to continue developing the skills in ICD-10 coding assignments, which is probably one of the most fun things to do as a coder. We begin to get right into these cases and begin to work them. All right, so I look forward to working with everybody. So please ensure if you need any assistance or if you have any questions, please feel free to reach out to me. You can contact me immediately through text message, an email, or a phone call. Okay, so I look forward to working with everybody. Have a great day, and until next time, journey well. Bye-bye.